Hi, I'm Dr. Stephanie Whalen with Troy Equine Services. I'll be showing you how to apply liquid drops or medication to your horse's eyes. The supplies that you will need are some dry gauze squares or a clean soft cloth, small syringe and needle. This is a 25 gauge needle that is a short 5/8 inch length, and a 1 milliliter syringe. And then the prescribed eye drops. It may either be in a dropper bottle, which is difficult to apply to a horse's vertical eye without wasting a lot of the medication and not properly getting it in. So it may instead be transferred into a vial for you, because that's a little bit easier for us to handle. And then I also do find that some small treats are really helpful as a reward to help the horse cooperate. We're going to drop our dose. We're going to be using 0.2 milliliters of this medication, removing the cap from the needle. The needle is attached to the syringe. I'm going to insert the needle through the rubber stopper of the vial, and I'm just watching for the fluid level. Recapping the needle so that I don't poke myself. And then when we remove the cap and needle together, now we have a nice blunt tip of the syringe to use as a dropper with the horse's eye. If the eye drop is in a dropper bottle rather than a vial like this, the way that you will draw up the medication is to use your syringe and needle. Again, you'll need a small 25 gauge needle to do this. I'm gonna remove the cap from the needle. I have my thumbnail here just to help hold the needle on the syringe. And then I'm going to carefully insert the needle into the channel of the dropper, and then draw back with the plunger to get the liquid into the barrel of the syringe. To start, I check and see if the eyelid is damp from either previous medication or from tearing or discharge. Just give a gentle wipe, and that will allow you to have better grip of the eyelids while you're manipulating them. Typically with a syringe, when you're administering an injection, you would hold the syringe like a writing utensil. I personally find when I'm applying an eye medication that if I hold the syringe in my hand like this, it allows me to actually choke up on it, and then I can lean my hand against the horse, and if they move, I can move with them without poking them in the eye with the syringe. So I'm going to position my syringe like this, and then I can use my thumb to depress the plunger to actually apply the medication. I'm going to start with my index finger and thumb in order to lift the upper eyelid and bring the lower eyelid down to make a gap that we can deposit the medication at the front corner of the eye. And if you start with your fingers in a bent position like this, rather than starting in a straightened position, that will allow you to have the range of motion to actually lift the upper eyelid. And the upper eyelid is the strongest one that you're going to have to use the most pressure against. It's also helpful to remember that there's a nice firm bony socket around the eyeball, and so we're aiming to lift the upper eyelid towards that bony socket so that we can brace a little bit against that. I'm going to position my hand with the syringe near the patient and just make sure that they're quiet and comfortable with that. And then I'm going to use my index finger and thumb right in that crease of the upper eyelid to lift upward. And then I'm depositing the medication in that front corner of the eye. And we're aiming to get the medication on the pink conjunctiva, that's the mucous membrane of the eyelid, and then it'll wick across the eye. Good girl. And she'll get a little treat for being cooperative for that. Good girl. The process is the same for the other side, but your positioning of your hands may be a little bit different depending on whether you're right or left-handed to apply to the opposite side. Good girl. So I'm just going to brace my hand with the syringe against her, make sure that she's quiet with that, and lift, and then deposit. Good girl. She'll get a little treat.